Hi, it's Twila from Citizens Council for Health Freedom, and I thought I had a great conversation with Dr. Kimberly Jackson and thought there might be some things you all would be interested in regarding what's happening in the exam room that is going on besides taking care of you, the patient. I think you'll find this interesting. Let me introduce you to Dr. Kimberly Jackson.
Hi, everybody.
And she's just going to tell you about what happens in the exam room when,
Yeah, when you get in there. Exactly, right, exactly. So first of all, everyone, hi, it's great to be here. And Twila is an awesome advocate of patients, physicians, nurses for wonderful healthcare. So it's a delight to have shared lunch with her and have this conversation. So we basically were talking about, we had a recent healthcare town hall, and one of the questions we got was, why isn't my appointment time at the time they say, and why does it take so long to get in the doctor's office? So I was sharing with her some of the things that happen when the patient is in the exam room with us that kind of, affects everyone's care. And essentially, you have the whole process when you go through, if you have insurance or not insurance, of course, they got to verify your address and your phone number. So, a few of those things kind of delay you from getting that exact time that you had an appointment and going to see the doctor, which is very needed because you don't want to have surprise bills, right? You don't want to have things that you have to pay for that you didn't know that were going to come up. The other thing is, of course, they have to triage you, which is get your blood pressure, your vital signs, your weight. They need to find out why you're there. We may think you're there to just refill medicines, but you actually may have an issue. You may have, a cough, or you think you have a urinary tract infection, or you may have something more significant or serious, including things like chest pain or shortness of breath. So when they bring that information to me, the MA, the nurse, or whatever, and I get you in the exam room, it's a lot of things that go on, right? One, we have sometimes these other people in the room that we actually are working together with Twila and other groups and groups like physicians working together to kind of remove. So you have the insurance company, you have the medical equipment company, you have, your concerns, my concerns, family issues, all those things impact what's going on in the exam room and how long it takes to get you what you need. We go through then your complaint. Like I said, we may think you're there for refills, and you may say chest pain, shortness of breath, things like that are very serious concerns. And so we can't just blow it off and say, oh, well, you're fine, maybe it's reflux, take a Tums, we'll see you later. So sometimes the things that affect what goes in the exam room is the complaint that the patient has, how serious that is, and things we need to do to be able to evaluate what that complaint is and how we can take care of you. The other thing is, yes, we may make a certain amount of patients for the day that we can see, but we sometimes accept other people in. Someone calls and says, hey, my baby has, I think, a ear infection. Well, if that was your child, you want us to see them, right? So if that person sometimes may slip in a little bit before your appointment, that may sometimes make your wait longer. But the biggest thing that goes on in the exam room that affects and impacts how long or how quick you're able to get in is just that relationship and that connection with the physician that basically is dealing with the problem you have at hand. And I tell patients all the time, when I'm with you in that room, it's just you and I, in the sense of I want to be present with you, I want to hear your concerns, and I don't want to be dictated by, per se, the clock or the fact that, I have a couple other people waiting, because it's your time. So if you're sharing with me there's a loss of your mom or your sister or your brother, I can't be like, okay, that's fine, but I got 10 other people to see, I need to rush out. Or if I have to share bad news with you, you know what, this looks bad, you may possibly have cancer. That's not the time for me to be like, okay, you got that, okay, you'll be fine, we'll be in contact with you. So what I like for most patients to realize is, doctors, we value your time. We're not back there, Candy Crushing and Facebooking and playing, games and things like that. We're dealing with life and death situations, as well as sometimes there are administrative things we have to deal with, prior authorizations that we're trying to make sure you get the medicines that you need, or phone calls to colleagues to make sure that we got the previous reports that you did when you went to the emergency room or to your radiologist or to your surgeon. It's a lot of things that go into the visit that aren't just as simple as see them, get them checked in, get them checked out, and let you leave. So just realize your time is valuable, and the time that we're spending with everyone, it's needed and it's important. And we want to make sure you get the time that you deserve too. So we make sure the person that is before you or after you is getting the time they deserve as well. And so we all just have to work together, and we have to realize that everyone's time is important, and then we realize that, hey, we're really doing this for you. We want to make sure you get the care that you deserve. And just realize that when we're in there, if it takes a little longer, in our office, I try to tell them, go out and tell the office, hey, we had a little emergency. Some people may pass out, some people may, we think they're having a heart attack, we have to call an ambulance. Those things affect the length of time you're there. People are not perfect, right? So we can't, just totally plan everything in the office, but just know your time is valuable, and there are a lot of moving pieces that go into the visit when you're seeing people.
So Dr. Jackson, tell our listeners who have tuned in, and thank you for coming in, and David and Tony.
Hello.
Will you tell them about the interlopers and about the electronic health record? How does that?
Oh my God!
How does that impact what happens between the patient and the time and all that? Sort of thing?
Exactly. So this is an excellent question, because the other thing that is that big part in the exam room, particularly for a lot of offices that have adopted EHRs because it was kind of mandated by the government. And it has its pros, but unfortunately sometimes the cons of that is before we can actually move forward sometimes in different things that are ordered or things that we can do for the services that you need, is we have to input it in, type it in, click these boxes and make sure these things are done so you can get these services paid for by your insurance company. And it does. Sometimes it distracts from us being able to have that face-to-face conversation with, the patient. The issue is if we try to wait till the end of the day and do it, then now, of course, it gets to be, hey, I'm a mom, I'm a wife, that I have to take this home. It's the homework that you don't want to have to do, right? So we are, so literally trying to either click these boxes or do these things after hours. And of course, I tell people, if you have a happy doctor, a happy nurse, you have happy patients, because we all work together. And you don't want them being up hours afterwards, clicking boxes and filling out, insurance paperwork and things like that. You want them getting rest so they can give you good care. So this interloper of the EHR, and understand, physicians, we are not anti-tech. We just want it to work better. The interloper is this requirement to have these systems that really aren't efficient for physician and patients. They really aren't efficient for us to be able to give the care that patient needs. And then we're sitting there and we have to sometimes stare at the screen and click those boxes and do those things. Of course, you feel like we're maybe not listening or we're not totally there, but understand that we're definitely trying the best we can to be there, as well as comply with, federal regulations, and make sure you get the things that you need. And of course, make sure your services are paid for, those that have insurances. We don't want you having surprise bills or things not covered. So we try to make sure that we're doing what the government, the insurance, and other entities require us to do to make sure those services are, documented and covered.
So before we leave, and I should tell everybody that we are here in the, let me see, which building
exactly.
we're in?
The Rayburn
We're in the
House
Rayburn,
building.
the Rayburn House building in Washington, D.C.
Yay.
Yep, and we are here for the National Physicians Coalition for Healthcare Policy.
Exactly.
And Dr. Jackson runs a group. You want to show them your t-shirt?
Yeah, absolutely. So the group that was founded, Facebook, June 2015, and going on our second year, is Physicians Working Together. And it's basically a group that wants to bring all physicians, medical students, residents, nurses, healthcare allies together and just have one a central source where you can get information about a lot of things that are going on. We don't want to reinvent the wheel. I tell people we're not here to replace different groups. We're not here to try to restart and do some things. We just want a site where if you have information about what's going on maybe in your state or city, you can go to this website and get that information, which is www.thepwt.org. And then we have a couple of pages, National Physicians Week and Physicians Working Together, and that's an initiative I was telling Twila about. We not because she's a nurse, we really do mean this. We really love our nurses, we appreciate them, and we actually love how they do things with their union and just the fact of National Nurses Week. And so one of the things that Physicians Working Together has an initiative is National Physicians Week. So we're taking Doctors Day from March 30th to the whole week, March 25th through the 31st, and it's basically to reintroduce America to her physicians, that we love what we do, we're here for you, we support our healthcare allies, and we want to just make sure America has the best healthcare system. We want to make sure that we hear from you and that you realize we really love what we do and we care about you all. So we're excited.
So the two most important people in the healthcare interaction are the patient and the doctor. And so we have been here for 2 days listening to listening to doctors talk about sort of the trials and tribulations that are happening in healthcare today. We've had some conversation about the GOP leadership bill, not a lot, but it's been very interesting. It would be great for everybody to hear from their doctors what their perspective is. So the next time that you go in and have a doctor's visit, ask your doctor what's the most difficult thing for them to deal with in healthcare today, and I think it might be an educational surprise for you. So thank you, everybody, for tuning in. Thank you, Dr. Jackson, and we'll stay live come back for another live presentation later. Thanks.